Welcome back, everybody. This is the next installment of one of our educational videos. Today we're going to be talking about minimally invasive lumbar decompression, which is known as the mild procedure. And I am Dr. Edward Rubin. I'm board certified in both anesthesiology and pain management. And today we're here to try and educate and give you some information about some pretty high-level technology that's out there. So the mild procedure is a treatment for patients with lumbar spinal stenosis. Lumbar spinal stenosis is a pretty significant problem. There's about 2 million people a year diagnosed with lumbar spinal stenosis in the United States. The symptoms of lumbar spinal stenosis, typically you're going to see low back pain, possibly numbness, tingling going into the legs. These patients normally give you a story of difficulty with standing, difficulty with prolonged walking. The classic question we ask in the office is, when you're walking around the supermarket, are you the one leaning on the shopping cart while you walk around because of back pain? And that's called the shopping cart sign. And that's your body's way of trying to make a little more room in the spinal canal so that you can walk a little further despite the pain. Um, Patients with lumbar spinal stenosis are obviously limited. It affects their ability to travel, to go long distances. But we do have a treatment algorithm. We normally start with injections, epidural injections, and then mild could fit in as soon as step 2 after you try injections. We want to get patients back to functioning again, doing the things that they like to do. Obviously, walking around with stenosis precludes you from doing a lot of outdoor activity because you're not able to stay on your feet for such a long period of time. Let's talk a little bit about the procedure. It is an outpatient procedure. From a safety standpoint, this is similar to an epidural injection in terms of risk. You've got no general anesthesia, can be done with just sedation. There's no implants or anything put in you, no stitches, no steroids or opioids used for this particular procedure. First, you need to determine, are you a candidate? So you'll see an example there of a healthy spinal canal. And then you'll see as you age, we get what's called thickening of the ligaments in the spine. Essentially, it's an arthritic condition where the spinal canal, because of arthritis and degenerative disc, builds up extra tissue. And essentially, the hula hoop, which is your spinal canal, starts to shrink. And the nerves that are in that hula hoop, it's almost like a fat person stuck in a hula hoop that's too small. So the treatment is either to shrink the nerves inside the hula hoop, which is what you would do with an epidural injection where you're trying to reduce inflammation and shrink the nerves. In this procedure, you're actually trying to widen the hula hoop and decompress some of the problem area that's shown there. And by decompressing that, you can make just enough more room so that people can function with less pain. So the procedure is done through a needle essentially. It's about the size of a pencil. Um, the example they give there was about as thick as a baby aspirin. So that's a small stab incision, so less than a half-inch incision. You can do multiple levels with one incision. You can do left and right side with one incision. And through the trocar that you see there, and under X-ray guidance, we're actually scooping out some of that tissue there. So their proprietary device allows this to be done under X-ray guidance. And as we said, from a safety standpoint, this is not much more risky than an epidural. And as you decompress that tissue, you'll see the canal opens up. And that's really just from mechanically scooping out the tissue in the back. Patients are usually in the OR less than an hour. They're going home the same day with basically a Band-Aid and some Tegaderm on their back. You can go back to normal activity within 24 hours. So this is a pretty quick recoup. You can resume physical therapy after the procedure. And over time, we see patients actually do quite well. The evidence so far shows that in terms of long-term data, we've done thousands of these procedures. So while there's not a ton of people that do this, this is a high-level procedure. It's been out, it's safe. Patients are extremely satisfied after having the decompression. In terms of long-term outcomes for up to a year, we're seeing people can stand 7 times longer, walk 16 times further. I mean, these are pretty dramatic changes in terms of what people are experiencing. Again, this is a procedure brought to you by Vertos, the maker of the mild device. This procedure is not a first line, so I need people to understand that traditionally this is something where you would do epidurals first. In my practice, I also get a surgical consultation. I don't want people to feel that like we're railroading them into this minimally invasive option when maybe they would have been better off with a traditional open surgery. So I like to basically have the surgeons weigh in. Where this is fitting into the practice algorithm is mainly for patients who are either too old or too ill to have a major surgery. So I got a lot of patients in their late 80s, early 90s. They're not going to tolerate a big open back surgery. So on the pros and cons side for this procedure, obviously the pros are minimally invasive, no general anesthesia, no implants, in and out in about an hour or two, and the recovery is quick. But this is not direct visualization of the tissue like you would have when a surgeon goes in and does an open back surgery. So I do like it when my surgical colleagues weigh in, say, hey, this patient probably isn't going to tolerate a big back operation. Let's go with a minimally invasive option. On the plus side, also, this procedure, lasts for quite a long time. It would literally take years for that hypertrophy to come back. It can be done at multiple levels. I've done as many as 3 levels in a sitting if needed. But typically, you're just going after the levels where the worst of the stenosis is. I hope this information was helpful. Please like the video. Please subscribe. If you have comments or questions, please keep them generic. There's no personal information posted because of HIPAA reasons. So if you want to reach us directly, our contact info is there. If you have other videos that you're interested in, please let us know, and we'd be happy to make more informational content for you. I appreciate your time, and again, please like and subscribe. And I appreciate you hearing me out, and I hope you found this information helpful, and we'll be in touch again shortly.